Good morning, friends. Today we will see the part 9 of questions and answers of OBG nursing. If you have benefited my sessions, please do subscribe and share with your friends. The commonest lie of fetus in multiple pregnancy is longitudinal. Shape of uterus in multiple pregnancy is barrel shape. The characteristic sonographic sign of twin gestation is lambda or PEG sign. Complication of multiple pregnancy commonly affect the fetus. The second fetus state where liquoramine exceeds 1000 ml is called as polyhydramnios. State where liquoramine is less than 200 ml, a term is known as oligohydramnios. The characteristic auscultation finding of polyhydramnios is known as fluid trill. The drug which is given annually to reduce amniotic fluid. Indomethacin. Acute polyhydramnios occur before dash week of pregnancy 20. The triad of symptoms of acute polyhydramnios include nausea, vomiting, and abdominal distension. The condition in which there is a failure of secretion of amniotic fluid by the cells of amnion covering the placenta is known as amnion nodosum. The normal vomiting in pregnancy is known as simple vomiting or morning sickness. The excessive vomiting during pregnancy is known as hyperemesis gravidarum. The vomiting occurs due to an increased level of DASH hormone, HCG hormone. The morning sickness will disappear at the end of third month. The type of placental abnormality in which thin fibrous ring is present at the margin of chorionic plate where the fetal vessels appear to terminate is known as circumvallate placenta. The type of placental abnormality in which one or more small lobes of placenta may be placed at varying distance from main placental margin is known as placenta succenturiata. Abnormality in which cord is attached to the margin of placenta is battledore placenta. Abnormality in which cord is attached to the membrane is known as filamentous placental insertion. The short cord is in which the cord is less than 20 cm or 8 inch. Jelly-like material present in the cord is called as Watson's jelly. The bleeding from or into the genital tract after 20th week of pregnancy but before the birth of baby is known as APH or antepartum hemorrhage. When placenta is implanted partially or completely over lower uterine segment, it is called as Abruptio placenta. Placenta previa. Bleeding occurring due to premature suppression of normally situated placenta is Abruptio placenta. Condition in which fetal vessels overlying internal os or in front of the presenting part is called as vasa previa. The only symptom of placenta previa is painless vaginal bleeding. The characteristic sign of placenta previa is stalworthy sign. The incidence of abruptio placenta is 1:150. The complications of concealed hemorrhage is known as covellar uterus. IV fluid is for the baseline management of abruptio placenta is wrinkle lactate. The hypertension without proteinuria and pathological edema is called as gestational hypertension. The hypertension and proteinuria without pathological edema is known as pre-eclampsia. Pre-eclampsia complicated with convulsions or coma is called as eclampsia. The multisystem disorder characterized by development of hypertension to the extent of 140/90 mm of mercury with proteinuria after 20th week in previously normotensive and non-proteinuric patient is called as preeclampsia. The hypertension that develops as a direct result of gravid state is known as pregnancy-induced hypertension. For preeclampsia, the rise of blood BP should be evident at least 2 occasions at least 6 hours apart, 4 to 6 hours apart. What is HELP syndrome? H stands for hemolysis, EL stands for elevated liver enzymes, and LP stands for low protein. Biochemical marker of preeclampsia is serum uric acid level. Supplementation reduces development of preeclampsia are calcium, vitamin E, and vitamin C. The word eclampsia means like a flash of lightning. When fits occur in continuous successions, it is known as status eclampticus. Rapid worsening of preeclamptic state is known as acute fulminating preeclampsia. Drug used for treatment of prevention of eclamptic fit is magnesium sulfate. The therapeutic level of serum magnesium sulfate is 4 to 7 milliequivalent per deciliter. Commonest haematological disorder complicating pregnancies anemia. According to WHO, anemia in pregnancy present when Hb concentration in a peripheral blood is less than 11 gram percentage or less. Disease responsible for 20% of maternal death in third world countries is anemia. Minerals other than iron is necessary for synthesis of hemoglobin is copper and cobalt. Hormone which is necessary for hemoglobin production is erythropoietin. The condition in which there is a variation in size of RBC of unequal size is known as anisocytosis. If you have benefited from these sessions, please do subscribe and share with your friends. Thank you, friends. Thank you.